Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. In today's video, we're going to be discussing a medication known as Fosfomycin. Now, before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. Now, during this presentation, we'll discuss the mechanism of action or how this medication works, indications or reasons we would prescribe Fosfomycin to a patient, followed by contraindications or reasons we would not be able to use this medication. We'll then touch on an example of dosing and then finish it off with side effects with percentages. I've put together some slides to go over this information, so let's jump right into it. So the first thing to discuss here will be the mechanism of action or how this medication works. So fosfomycin inhibits bacterial cell wall synthesis via inactivation of enolpyruvyl transferase, resulting in bactericidal activity in the urine. Fosfomycin also decreases bacterial adherence to uroepithelial cells. In terms of indications or reasons we would prescribe this medication to a patient, we may see it used in the treatment of an uncomplicated urinary tract infection in women. With respect to contraindications or reasons we would not be able to prescribe fosfomycin to a patient, well, we just wouldn't give this medication to a patient who had a hypersensitivity to fosfomycin or to any other component of the formulation. Now for an example of dosing with fosfomycin, so in the treatment of an uncomplicated urinary tract infection in women, we would see a single 3-gram dose mixed with 3 to 4 ounces of water taken orally with or without food. As with all medications, there are some side effects or adverse reactions that patients may experience while using fosfomycin, so we'll go over some of those common side effects here now. About 9.5% of patients may experience diarrhea, while 4.5% of patients may experience nausea. A backache seems to happen about 3% of the time, and a headache 4% to 10% of the time. Dysmenorrhea happens 2.5% of the time, and as well 2.5% of patients may experience pharyngitis. Rhinitis may occur 4.5% of the time, and 2% of patients may experience pain of some sort. Alright everybody, that's all we're going to talk about today with Fosfomycin. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and would like to help grow this channel, remember you can like the videos, share the videos, and most importantly subscribe to the YouTube channel. There's also some links in the description you can check out as well. So for today, take care.